An infant in Toronto is the latest to have a reported case of measles in Canada. According to Toronto Public Health, the case has been linked to travel and the infant is currently in hospital. On Tuesday, a case was reported in Peel Region in another child with a history of international travel. Dr. Isaac Bogosh says this is why vaccination is so important when it comes to the virus.
There's very little wiggle room for measles vaccine. You really need to have immunity over 90% and preferably over 95% in a population.
Measles has been effectively eliminated in Canada for many years, but Interior Health Medical Officer Dr. Fatima Sabed in BC says more than 90% of people not vaccinated against it could catch it if exposed. Measles symptoms can start between 7 and 21 days after infection and typically include a high fever, cough, runny nose, and red watery eyes, with the rash following a few days later. Sabet says if you have been exposed, monitor your symptoms, especially if it's a fever or rash.
They need to isolate right away, and especially from vulnerable people who are not vaccinated for measles.
She adds some of the most vulnerable are those under 1 who likely haven't received their vaccine yet, pregnant people, or those with a weak immune system. However, those vaccinated may not have much to worry about, whether at home or abroad.
Generally, if you're vaccinated for measles, you've got pretty robust immunity. It's about 97% effective in reducing the risk of measles infections.
Bogosh adds people should speak with their doctor, as some may not have the second needed dose. If you do hear about a case in your community, though, Sabet says those without a vaccine should check what locations have been exposed, and if they've been to those places, to seek medical attention, such as getting your vaccine. Sean Previl, Global News.